Καλησπέρα σας. Την εκδήλωση για την αναγόρευση του καθηγητή παθολογικής ογκολογίας στην Ιατρική Σχολή του Πανεπιστημίου της Βαλένθια και Προέδρου της Ευρωπαϊκής Εταιρείας Παθολογικής Ογκολογίας, κυρίου Andres Cervantes, σε επίτιμου διδάκτορα του Τμήματος Ιατρικής, θα προσφωνήσει ο πρίτανης του Εθνικού και Καποδιστριακού Πανεπιστημίου Αθηνών, καθηγητής Γεράσιμος Σιάσος. Address by the Rector of the National and Kapodistrian University of Athens, Professor Γεράσιμος Σιάσος.
Αξιότιμη κυρία Αντιπρίτανη, αξιότιμη κυρία Κοσμήτορα, αξιότιμη κύριε Πρόεδρε, αξιότιμη κύριε Πρόεδρε της Ιατρικής Σχολής, του Νοσηλευτικού Τμήματος, αγαπητές και αγαπητοί συνάδελφοι, πιστοί στην παράδοση του Ιδρύματός μας να αποδίδουμε τιμές σε προσωπικότητες που διέπρεψαν στην επιστήμη και προσέφεραν πολύτιμες υπηρεσίες στην ανθρωπότητα, έχουμε σήμερα τη χαρά της απόδοσης της ύψης της τιμής, της ανακήρυξης σε επίτιμο διδάκτορα της Ιατρικής Σχολής του Εθνικού και Καποδιστριακού Πανεπιστημίου Αθηνών, στον καθηγητή Andres Cervantes, ενός ανθρώπου που έχει αφήσει ανεξίτηλο αποτύπωμα στον χώρο της ιατρικής επιστήμης. Ο τιμόμενος είναι καθηγητής ογκολογίας και επικεφαλής του Τμήματος Παθολογικής Ογκολογίας στο Πανεπιστημιακό Νοσοκομείο της Βαλένθια. Η αξιοθαύμαστη επιστημονική του πορεία χαρακτηρίζεται από ένα πλούσιο κλινικό και ερευνητικό έργο, το οποίο έχει συμβάλει καθοριστικά στη διαμόρφωση της σύγχρονης ογκολογίας και έχει επηρεάσει βαθιά την ιατρική κοινότητα παγκοσμίως. Τα πρώτα λαμπρά βήματα της ακαδημαϊκής του πορείας ξεκινούν με την ειδίκευσή του στην παθολογική ογκολογία στο Πανεπιστημιακό Νοσοκομείο της Βαλένθια και συνεχίζεται με την εκπόνηση της διατριβής του στο Ελεύθερο Πανεπιστήμιο του Άμστερνταμ με θέμα την ανθεκτικότητα στην αντινεοπλασματική θεραπεία. Ως επικεφαλής του Τμήματος Παθολογικής Ογκολογίας και του Ινστιτούτου Υγείας in Κλίβα, έχει αναδείξει νέες προοπτικές στη μελέτη και την αντιμετώπιση του καρκίνου. Τα πρωτοποριακά του προγράμματα, όπως η μοριακή ταξινόμηση των γαστροεντερικών καρκίνων, έχουν ανοίξει νέους ορίζοντες στην ογκολογική πρακτική. Ο τιμόμενος έχει ηγηθεί ευρωπαϊκών προγραμμάτων, όπως το Legacy, που ενισχύει τη διεθνή συνεργασία και τη μεταφορά τεχνολογίας για τη μελέτη του καρκίνου του στομάχου, συνδέοντας χώρες της Ευρώπης και της Λατινικής Αμερικής. Οι δημοσιεύσεις του, οι οποίες είναι περισσότερες από 300 σε κορυφαία επιστημονικά περιοδικά, μαρτυρούν την πολυδιάστατη επιστημονική του πορεία. Ως πρόεδρος της Ευρωπαϊκής Εταιρείας Παθολογικής Ογκολογίας, ΕΣΜΟ, ο κύριος Cervantes έχει ενισχύσει τη διεθνή συνεργασία στην ογκολογία. Οι δράσεις του στον τομέα της εκπαίδευσης και της ανάπτυξης νέων θεραπευτικών προσεγγίσεων τον καθιστούν σημείο αναφοράς για την επιστημονική κοινότητα. Η διακεκριμένη συνάδελφος, καθηγήτρια παθολογίας ογκολογίας και διευθύντρια της δεύτερης πανεπιστημιακής παθολογικής κλινικής στο νοσοκομείο Αττικό, κυρία Αμάντα Ψηρή, η οποία θα ακολουθήσει στο βήμα, θα αναφερθεί εκτενέστερα στο πραγματικά πολύ σημαντικό έργο του τιμωμένου και θα μας δώσει εναργέστερη εικόνα για ένα διεθνώς καταξιωμένο επιστήμονα, ο οποίος έχει διευρύνει τα όρια της ογκολογίας και έχει εμπλουτίσει πνευματικές παραδόσεις πολλών ιδρυμάτων παγκοσμίως, συμπεριλαμβανομένου και του δικού μας. Dear Professor Cervantes, on behalf of the Rectory Authorities of the National Kapodistrian University of Athens, I would like to express my sincere congratulations. It's a great honor for the academic community of the National Kapodistrian University of Athens to welcome you to our institution. We're proud to acknowledge your great contribution to science, and especially to medical oncology, and we're deeply grateful to be inspired by your work. We wish you all the best in the progress of your scientific work and all your future endeavors. Thank you.
Παρουσίαση του έργου και της προσωπικότητας του τιμωμένου από την καθηγήτρια Παθολογίας Ογκολογίας του Τμήματος Ιατρικής του Πανεπιστημίου Αθηνών, κυρία Αμάντα Ψηρή. Presentation of the distinguished career and accomplishments of the honoree by Professor of Medical Oncology at the Department of Medicine of the University of Athens, Mrs. Amanda Ψηρή.
My Rector of National Kapodistrian University of Athens, Professor Γεράσιμος Σιάσος. My Dean of the Medical School, Νικόλαος Αρκαδόπουλος. Academic authorities and members of the university. Dear Chair of the Hellenic Society of Medical Oncology, Dr. Zenia Saridaki, distinguished colleagues, friends, ladies and gentlemen, today we are honored to award the title of Doctor Honoris Causa of National Kapodistrian University of Athens to Professor Andres Cervantes. This is a significant moment for Professor Cervantes and us, whose outstanding contributions to medical oncology have inspired many oncologists in Greece. It is also a special occasion for the faculty of the university, as Professor Cervantes has shown a strong dedication to research, education, and patient care throughout his career. This award acknowledges his commitment to oncology education, research excellence, and leadership. We aim to inspire our students to excel in education, research, and patient care. Professor Cervantes, after studying medicine at Universidad de Murcia, he specialized in oncology at the Clinical University Hospital of Valencia, one of the leading centers in Spain, which has been promoting and training in medical oncology since 1980. After completing his clinical training, he got a 2-year research fellowship at the Free University Hospital in Amsterdam, where he obtained his PhD with a work on multi-drug resistance in the cellular pharmacology lab of this institution under the mentorship of the famous professor Bob Pinedo. Dr. Cervantes currently serves as head of the Department of Medical Oncology at the University Hospital in Valencia, Spain. He is also scientific director of the Institute of Health Research in Cliva, one of the nationally accredited research institutes in Spain. Clinical medicine and teaching are his main passions. His main areas of research and clinical interest are gastrointestinal and gynecological malignancies, as well as phase 1 and early clinical trials and new drug development. Professor Cervantes is considered one of the best European specialists in clinical and translational research on rectal cancer. He is a dedicated clinical investigator for rectal cancer, a topic in which he has developed several publications concerning the quality of the multidisciplinary teamwork, as well as quality assessment of mesorectal surgery, how to improve on the optimal selection of initial therapy, and specifically how to approach upper third rectal cancer. He is also responsible for a translational research lab, mainly working in liquid biopsies and in the molecular classification of gastrointestinal malignancies, as well as in the mechanisms of resistance for HER2 blockade in gastroesophageal adenocarcinomas. He recently published a paper in Nature Cancer on molecular progression model of colorectal cancer. He is leading an EU-granted project on gastric cancer, including EU and Latin American countries, to foster international cooperation and technology transfer in molecular studies for gastric cancer, legacy. He is the author of more than 600 research articles and educational papers published in peer-reviewed journals. He is also one of the editors-in-chief of Cancer Treatment Reviews. Dr. Cervantes is currently past president of the European Society for Medical Oncology. He has been serving ESMO in different working groups and committees since 2000. He started as a member of the Educational Committee, chairing the Continuing Medical Education and E-Learning working group. He became the subject editor for gastrointestinal cancer in the ESMO Clinical Practice Guidelines, becoming chair of the Guidelines Committee thereafter. In 2014, he was the scientific chair of the ESMO Congress in Copenhagen. He was the chair of the Educational Committee and Transitional Director of Education, and he has a seat on the ESMO Council and Educational and Executive Board. Since January 2014, he's an associate editor for gastrointestinal cancer in Annals of Oncology. He also chairs ESMO preceptorships in colorectal and gastric cancer and the ESMO Summit in South Africa, Russia, and Latin America. Professor Cervantes is a dedicated oncologist and educator who embodies quiet strength. He has led ESMO with wisdom and vision, and is deeply passionate about research and education. His invaluable contributions to medical student courses in Ioannina, alongside Professor Nikolaos Pavlidis, have inspired many. Professor Pavlidis devoted a few words for Professor Cervantes. It is my great honor and great pleasure to devote a few words regarding Professor Andres Cervantes, whom I have known for almost the last 25 years. We've been working together since, from 1996 to 2014 in ESMO as members of the Education Steering Committee, between 2006 to 2011 in the ESMO Guidelines Task Force, and from 2003 to 2023 in organizing the ESMO oncology courses for medical students. I always enjoyed our collaboration. He was always, and he's still, an excellent oncologist, a superb teacher, and an exceptionally polite friend. I wish all the best to him. Andres has mentored countless Greek oncologists, tirelessly advocating for them to assume leadership positions within ESMO. Summarizing Andres Cervantes' remarkable career in just a few minutes is challenging, as he exemplifies a profound commitment to oncology education and research. Andres has a wonderful family. His wife, Laura, and his 5 children, Maria, Hannah, Andres, Manuel, Carlos, they are visiting Greece with him, and they are in this room today, and his sister, Anna. Today, we honor him with an honorary doctorate, a significant recognition from our faculty. At National Kapodistrian University of Athens, we proudly declare Professor Andres Cervantes as Doctor Honoris Causa of this university, forever linking his legacy with ours.
Αναγόρευση του τιμωμένου. Ανάγνωση των κειμένων του ψηφίσματος του τμήματος, της αναγόρευσης και του διδακτορικού διπλώματος από τον πρόεδρο του Τμήματος Ιατρικής, καθηγητή Νικόλαο Αρκαδόπουλο. Awarding ceremony. Presentation and reading of the department citation, the conferring documents and the diploma by the chair of the Department of Medicine, Professor Nikolaos Arkadopoulos.
Εθνικών και Καποδιστριακών Πανεπιστήμιων Αθηνών. Ψήφισμα του Τμήματος Ιατρικής της των Επιστημών της Υγείας Σχολής. Τύχη αγαθή, πρετανεύοντος το Ανθήνησιν Εθνικό και Καποδιστριακό Πανεπιστημίο Γερασίμου Δέλτα Σιάσου. Κοσμητεύοντος εν των Επιστημών της Υγείας Σχολή, Εμμανουήλ Α. Πικουλή, και προεδρεύοντος εν το της Ιατρικής Τμήματι Νικολάου Φ. Αρκαδοπούλου, έδοξε νομοφόνος το τμήματι, Αντρές Τερβάντες, τα του ασκληπιού έργα μέγιστα επιστάμενων, την ιατρικήν επιστήμην έργοτε και συγκράμασιν προαγαγόντα, και την εαυτού φιλανθρωπίαν πολλαχή επιδειξάμενον, προς δε τούτης εύνουν της έλυσιν διατελούντα, επενέσετε αυτόν και του της ιατρικής τμήματος διδάκτορα επίτιμων αναδείξε. Το δε ψήφισμα τόδε εις μεμβράνα αναγράψε και τον του τμήματος πρόεδρον δημοσία εν τη αιθούση τη μεγάλη αναγνώντα και τα στιμάς ανυπώντα επιδούνε αυτό ή ανημέρα η αναγόρευσης γέννητο καθάν ενόμιστε. Εγένετο Αθήνησιν μηνός Δεκεμβρίου 3η και 10η έτους 3ου και 20ου και της χιλιοστού από Χριστού γεννήσεως. Ο του της ιατρικής τμήματος πρόεδρος Νικόλαος Φ. Αρκαδόπουλος. Αναγόρευσης. Επειδή περ το Τμήμα Ιατρικής της των Επιστημών της Υγείας Σχολής του Αθήνησιν Εθνικού και Καποδιστριακού Πανεπιστημίου, Andres Cervantes άξιον απέφθινε του επιτίμου διδακτορικού αξιώματος, η δε της των Επιστημών της Υγείας Σχολή, τούτα παιδέξατο και ο πρίτανης της σχολής γνώμη επινεύει, διατάφτα εγώ, Νικόλαος Φ. Αρκαδόπουλος, καθηγητής της Γενικής Χειρουργικής, νύνδε του Τμήματος Ιατρικής Πρόεδρος, Χρώμενος στη δυνάμει, ειν παρά των πανεπιστημιακών νόμων και του τμήματος έχω λαβών, Andres Cervantes, επίτιμον διδάκτορα του Τμήματος Ιατρικής της των Επιστημών της Υγείας Σχολής του Αθήνησιν Εθνικού και Καποδιστριακού Πανεπιστημίου, δημοσία αναγορεύω και πάσας αυτότας προνομίας, τα στο πανεπιστημιακό τούτο αξιώματι παρεπομένας απονέμω. Εγένετο Αθήνησιν, μηνός Ιανουαρίου, 9η, έτους 5ου και 20ου και της χιλιοστού από Χριστού γεννήσεως. Ότου της Ιατρικής Τμήματος Πρόεδρος Νικόλαος Φιαρκαδόπουλος. Ελληνική Δημοκρατία. Πριτανεύοντος εν το Αθήνησιν Εθνικό και Καποδιστριακό Πανεπιστημίου. Γερασίμου Δέλτα Σιάσου, καθηγητού της Καρδιολογίας Μοριακής Καρδιολογίας. Κοσμητευούσης εν το την Επιστημών της Υγείας Σχολή, Παγώνας Δέλτα Λάγιου, καθηγητρίας της Υγιεινής Επιδημιολογίας. Προεδρεύοντος εν το της Ιατρικής Τμήματι, Νικολάου Φιαρκαδοπούλου, καθηγητού της Γενικής Χειρουργικής, Andres Cervantes, από δόγματος ομοθήμου της των Επιστημών της Υγείας Σχολής, εις τους επιτίμους διδάκτορας εγκρίνομεν, μηνός Ιανουαρίου, 9η, έτους 5ου και 20ου και της χιλιοστού από Χριστού γεννήσεως. Ο Πρίτανης, Γεράσιμος Δέλτα Σιάσος, η Κοσμήτορ, Παγώνα Δέλτα Λάγιου, ότου της Ιατρικής Τμήματος Πρόεδρος Νικόλαος Φιαρκαδόπουλος.
Περιένδυση του τιμωμένου με την τίβαινο της σχολής από την Κοσμήτωρα της Σχολής Επιστημών Υγείας, καθηγήτρια Παγώνα Λάγιου. Investiture of the awardee with the gown of the School of Health Sciences by the Dean of the School, Professor Παγώνα Λάγιου. Ομιλία του τιμωμένου, lecture by the awardee.
Dear Professor Gerasimos Siasos, Rector of the National Kapodistrian University of Athens, distinguished members of its Senate, dear Professor Pagona Lakiou, Dean of the School of Health Sciences, dear Professor Nikolaos Arkadopoulos, Dean of the Medical School, dear Professor Amanda Siri, distinguished academic authorities from its medical school and other faculties, dear Nicholas, dear colleagues and friends, ladies and gentlemen, first of all, I would like to thank the Senate and the Rector of the National Kapodistrian University of Athens for the immense privilege and extraordinary honor of nominating me for this honorary doctorate. This is such an extraordinary award that I could never, even in my most extreme dreams, been able to reach this nomination, and particularly when coming from this very prestigious and internationally acknowledged academic institution. how a humble physician established in Spain could have been able to get this probably undeserved prize. I'm not going to deep into this point, but it has been perhaps the friendship, dearness, dedication, and efforts of some of my Greek friends, rather than my merits, the main reason why I'm here today speaking in front of you. I would like also to thank the warm introductory words that Professor Siri just pronounced. I do interpret her recognition as a valuable proof of kindness and friendship, and do very much appreciate a series of values expressed during her presentation. I acknowledge that the basic principles which helped and oriented my life are essentially Greek. And therefore, it is very easy to agree with Shelley, the English poet, who stated, "We all are Greeks." Yes, this is true. And I confess, when reflecting on the leading principles of Mediterranean as well as even Western societies, that we believe that when we understand Greek culture, we realize where and what our roots are. Professor Edith Hall, teaching currently at the King's College in London, stated that most ancient Greeks shared 10 qualities that I'm going to repeat for you. Of these, the first 4 are tightly connected and the most important. Those are, they were travelers, or particularly seagoers, suspicious of authority, individualistic, and inquiring. But beyond them, they were also open to new ideas, witty and humorous, competitive. They admire excellence in talented people, were elaborately articulated, and finally, they were addicted to pleasure. These features brought us into a higher level of civilization in a process of accelerating progression, or said in other words, constituted the so-called Greek miracle. Be these starting words to recognize the profound admiration I feel in front of the Greek culture. As a further example, please consider that the oldest universities in Europe, like Bologna, Oxford, Salamanca, or Paris, were initiated mostly in the 11th century, and therefore are essentially younger than 900 years, while the Academy of Plato was running from the year 387 before Christ to its abolition by Justinian in the year 529 of our era, for a total of 917 years, an impressive record of service in educating people and making a more advanced society. I could expand also on the Hippocratic medicine, in which the whole Western modern medicine is based upon. But not being myself an historian or a philosopher, I shouldn't do this. I must limit my address to the importance of precision medicine on cancer diagnosis and treatment, and I should focus on the role of circulating tumor DNA as a useful tool to personalize our decision in the clinic in patients with colorectal cancer. To precise means to discriminate and distinguish, focusing and acknowledging diversity among apparently similar features. I should start by referring to a revolutionary scientific discovery done in 1953 by James Watson, Francis Crick, and Rosalind Franklin, who described the double helix of deoxyribonucleic acid. The impact of such discovery in all biological disciplines has been fundamental in our understanding of many phenomena, including cancer. Joan Massaquet indicated that till that moment, all biological models were essentially empiric in a comparable situation of physics before Newton. This fundamental discovery was able to consolidate by making more concrete and tangible previous concepts that two giants of science already advanced in the 19th century. Charles Darwin, with his theory of evolution of species, and Georg Mendel, who established the basis of modern genetics by describing the concept of gene as a non-concrete element able to convey morphological and functional aspects acquired by individual cells or even complex creatures. Changes in some genes may confer more advantageous phenotypes able to better survive in front of others lacking such advantages. Remember that essentially cancer is a disease of genes. Without this background knowledge, our biological understanding of cancer wouldn't be possible. Next generation sequencing is every time more commonly used as a tool to decipher molecular alterations present in solid tumors with a double aim: to understand the underlying mechanism by which tumor progression is driven, but most importantly, to select specific targeted therapies that could have a relevant inhibitory effect on tumor growth, leading to effective tumor regression and of some cancers, and therefore improving survival and quality of life of patients suffering them. It has also become evident that some fragments of circulating tumor DNA could be detected in the plasma of patients with localized disease, and this finding could be applicable to detect minimal residual disease in patients who had surgery with curative intent, making a distinction by stratifying them according to the risk of relapse. This tool is also known as liquid biopsy and allows the determination of any tumor product, circulating tumor DNA, microRNAs, exosomes, etc., in blood or in any corporal fluids. Having this as our main hypothesis, our group started 10 years ago a research strategy to understand the role of circulating tumor DNA in patients with localized colon cancer. Our first paper on this work was published in 2019 in Annals of Oncology, the flagship journal of the European Society of Medical Oncology, showing in a series of 150 patients with localized colon cancer from stage 1 to 3, all of them operated on with curative intent, that 14% of them remained positive for plasma circulating tumor DNA 4 to 6 weeks after the surgical resection. This observation was very much related with the risk of relapse. In fact, in those in whom circulating tumor DNA became negative after surgery, relapse-free survival was over 80% at 5 years, while in the group remaining positive for circulating tumor DNA, only 15% of them remained disease-free at 5 years. The power of circulating tumor DNA to predict the risk of relapse exceeded the ones of conventional pathologically defined features, such as nodal invasion, vascular or perineural invasion, and stage, among others. The median lead-in time between the detection of circulating tumor DNA in plasma and clinical or radiological evidence of metastatic disease was 11 months. In cancer, circulating tumor DNA can be detected from cell-free DNA obtained from plasma and has potential for early diagnosis, treatment, resistance, minimal residual disease detection, and tumoral heterogeneity identification. However, the low frequency of circulating tumor DNA requires sensitive and specific techniques for accurate analysis. Multi-target assay, such as next-generation sequencing, need improvement to achieve limits of detection that can identify the low-frequency variants present in the cell-free DNA. Two primary methodologies have been developed for circulating tumor DNA-based minimal residual disease detection. Tumor-informed strategies, which identify tumor-specific mutations through initial tissue sequencing to guide circulating tumor DNA monitoring, and tumor-agnostic approaches, which utilize predefined panels to detect common cancer-associated genomic or epigenomic alterations directly from plasma without prior tissue analysis. The debate over which is superior in terms of sensitivity, specificity, cost-effectiveness, and clinical feasibility remains unresolved. Our group has recently published a critical review on the pros and cons of these methodologies. Our technology is basically tumor-informed, as we are searching first those molecular alterations which are present in the primary tumor to, in a second step, look for them in plasma, aiming at detecting minimal residual disease. Our team has been working on some technological refinements to improve the value of plasma circulating tumor DNA assessment, such as the inclusion of pairing analysis of tumor DNA and white blood cells, which improves circulating tumor DNA tracking and detects pathogenic germline variants. To further validate our findings, we embarked in a cooperative effort with a group led by Professor Claus Andersen from the Aarhus University in Denmark, where we could recruit 160 patients with stage 3 colorectal cancer treated with curative intent at Danish or Spanish hospital between 2014 and 2019. Detection of tumor DNA was confirmed to be a strong recurrence predictor postoperatively and directly after adjuvant chemotherapy. The recurrence rate of postoperative circulating tumor DNA positive patients treated with adjuvant chemotherapy was 80%. Only patients who cleared circulating tumor DNA permanently during chemotherapy didn't relapse. This information was reported in Clinical Cancer Research in 2022. However, at this moment, data from randomized prospective trials are very much needed to further validate this observation and to find its role in a standard of care. Those trials are fortunately underway. At the moment, some already reported studies justify not to provide adjuvant chemotherapy for those patients with stage 2 colon cancer in whom no circulating tumor DNA is detected at the postoperative setting. The circulating tumor DNA analysis informing adjuvant chemotherapy in stage 2 colon cancer trial was a randomized trial designed to investigate whether a circulating tumor DNA guided approach was compared with a standard approach. in stage 2 colon cancer to check if it could reduce the use of adjuvant treatment without compromising the risk of recurrence. In fact, the outcome of this study indicates that a circulating tumor DNA-guided approach to the treatment of stage 2 colon cancer reduced adjuvant chemotherapy use without compromising recurrence-free survival. The results of these trials suggest that a survival benefit from adjuvant chemotherapy may be obtained in a well-defined subgroup of patients with stage 2 colon cancer, namely those with detectable circulating tumor DNA after surgery. Treating only the patients who had detectable circulating tumor DNA reduced the percentage of patients who receive adjuvant chemotherapy as compared with standard management. By studying the molecular profile of plasma in patients with localized colon cancer, our team was also able to show superior capability in assessing intratumoral heterogeneity, overcoming the limitations associated to primary tumor tissue. These observations have been recently accepted for publication in Nature Cancer and will be released soon. Monitoring a greater number of variants, as well as whole exome sequencing in postoperative plasma sample increases the sensitivity and accuracy to detect minimal residual disease. The study of tumor evolution through plasma whole exome sequencing allowed the identification of novel acquired mutations at relapse, which were associated with the activation of the epithelial mesenchymal transition pathway, highlighting this and one of the mechanisms driving colon cancer progression. Moreover, the enrichment on functional mutation selectively favor specific genes, enhancing immune evasion, subsequently increasing tumor fitness during the relapsing process. Another valuable potential of circulating tumor DNA genotyping is to expand the number of candidate genes eligible for targeted therapies, allowing more efficacy in eradicating minimal residual disease and eventually curing more patients. Please allow me to state at this moment that medicine as a scientific discipline was initiated more than 2,500 years ago with the clear aim of alleviating the suffering of human beings. An Hippocratic sentence is making our task very focused, tangible, and concrete, as well as announcing the basis of precision medicine. There is no sickness, but sick people. Patience gives sense to all our tasks. Without patience, there is no medicine. After 45 years sharing the joy of practicing clinical medicine, I feel thankful and indebted to all patients who showed to me how to deal with hope, suffering, and love for keeping alive. They motivate me every day to be passionately dedicated to this fortunate job of taking care of others, learning from all, even minimal details, and at the same time, looking for innovation and searching for a better future. I would also like to thank my colleagues at the University Hospital in Valencia, where I've been working for the last 45 years. They give me every day the strength and a renovated commitment to advance in our task of serving patients. Please allow also me to mention my family, my beloved wife and my 5 kids who supported me with love and patience, permitting my dedication to this hard and at the same time happy duty of being a physician. To close, I'd like also to thank you all attending this ceremony, hoping not have deceived you with my simple words. Thank you very much.
Θα ακολουθήσει δεξίωση στο Πολιτιστικό Κέντρο Κωστής Παλαμάς, Ακαδημία 48 και Σύνα. Είστε όλοι καλεσμένοι. Reception will follow at Cultural Center Κωστής Παλαμάς and you are all invited.